Welcome to DC Academy's video on how to make a denture. At appointment number 1, you're going to want to use a stock impression tray to get a rough impression of the arch. Dental crafters can then fabricate a custom tray that will be custom fitted for that particular patient and take a much better impression. At appointment number 2, you're going to take the final impression using the custom tray. You're going to record the allometer reading, you're going to record the pupillometer reading, and you're going to want to select a method to record the vertical dimension. When taking the final impression using the custom tray, there are some areas that you're going to want to be aware of and make sure that you pick up landmarks indicated in this presentation. These landmarks are very important for us in fabricating a denture that's going to fit and function correctly for the patient. In these two arches, you'll see a pencil outline of the areas that are important to make sure that we pick up in the impression. This first one, the incisal papilla. The incisal papilla helps us determine the midline, and it also helps us determine the position of the anterior teeth. Hamular notches are also important. The hamular notches help us establish the occlusal plane specific for that particular patient. Here you'll see we've outlined the hamular notch areas. And in this picture showing our patient, the hamular notches are always level with the patient's pupillary line. We're going to see the buccal and labial fremen. These are important muscle attachments. If we start to impinge on these particular muscle attachments, we will have adjustments or sore spots in the denture. So we want to make sure that we pick and capture those particular areas. In this picture, we are marking more of the areas that we want to call to your attention to make sure that we impress correctly. You'll see the buccal vestibule areas. These buccal vestibule areas are important because it helps us determine where we're going to finish the border of the denture. On the lower arch, a couple areas that are extremely important are the retromolar pads. The retromolar pads help us establish, again, the occlusal plane. So in the maxillary with the hamular notches and with the mandible, the retromolar pads, we usually can get a very good idea of where the occlusal plane should be established for this patient. If the retromolar pads are not present in the impression, it becomes difficult for us to set that. We use the retromolar pads by splitting them in half. The retromolar pads splitting in half will then set that occlusal plane for the patient. Here you also see the vestibule areas are important. For the same reason on the maxillary, it's important on the lower, or the mandible, because it helps us determine the border of where we're going to finish the denture to. So in our finished denture, by picking up all of the landmarks that we indicated earlier, the function, the fit, and the overall aesthetics of the denture will be a great success. Along with the final impressions, you're going to want to take two readings, the allometer reading and the pupillometer reading. The allometer reading is basically measuring the width of the nose. The pupillometer reading is measuring the length of the lip. These two are important in helping us select the correct tooth, size, and shape to fit into that patient's face shape. So what we're trying to do here is find right here, from here to here, and then it just transfers down to that number. And perfect, so we got the 15. Okay. I'll just show them how that's resting in there. So this gets rested right there. Can you see that? Here you will see the Dental Crafters RX form. In the RX form, in the denture category, you will see an allometer and a pupillometer. Take the recordings from those meters and write them here. On the RX form, you're also going to see an area where you're going to be able to indicate which method you would like to use to record the vertical dimension. You can use a pin tracer, sometimes also referred to as a Gothic arch tracing, and there's a few other terms to be used for it, or more of the traditional base plates and bite rims. But there are two methods to record that vertical dimension. At appointment number 3, you're going to receive back your method you selected for registering the vertical, so either the pin tracer or the base plates and bite rims. In the video that's going to follow, we're going to demonstrate the use of a pin tracer. With the pin tracer, you're also going to need an instrument called a vertimeter. In the following video, you're going to see how to record a vertimeter reading. This reading is used in conjunction with the pin tracer. With the denture in, patient closed, I'm going to take an arbitrary number here. Alright, so we chose 20. We're going to put a dot there. So I have the patient count to 10. Then you're going to swallow and say M. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So where her vertical is at right now is pretty correct, where she should be based on the phonetics. So that's where we're going to set the ball bearing tracer at. If you forget any of the following in the video, all of the instructions on how to do this procedure are written on the back of the vertimeter. So here you can see the little ball bearing tracer tipped up. And then we're going to take a look and see where the vertical is heading. And here you can see we're going to have to increase the height of the pin because she is over closed. We're turning this to increase the vertical dimension. I'll check the vertical again. And there we have it. All I want you to do is wiggle your jaw back and forth, back and forth. Wiggle, 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 wiggle. Keep wiggling. Back and forth, back and forth, back and forth. All the way to this side. And this way. And this way. And this way. Okay, now forward. Forward and back. 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 Okay. And you will notice the tracing. So this is from the lateral movements and then the protrusive movement. And then we're going to put fix a little pin right here. And this right here would be centric for this patient. So here we have the sticky piece on there. So you can see there's a beveled edge right there, non-beveled edge. And we place the beveled edge up. And then right at the apex of those 3 lines is where that plastic piece goes. Open and close. Open and close. See how it goes right into the center of that pin? Now we're ready to lock the appliances together with the bite registration material. Okay, don't move after I put this stuff in your mouth. And then we're going to make sure that that pin is still inside of that little plastic piece. And that's what it should look like. And there's our vertical registration. The aesthetic control rim is used to mark the midline, the high smile line, and it's also used as a device to contour or try to establish the correct lip profile in the patient. So in the following video, we're going to demonstrate how this particular appliance is used in conjunction with the pin tracer. All right, so right here we're using the dental floss to help us find the midline of the patient. So here's our line. Like that to mark the midline. And then we're just going to verify it. I think we're pretty happy with that. And then we're just going to extend the line up just a little bit. All right, the next thing we're going to be taking a look at is the facial profile. The correct, basically is going to get this facial profile of where the anterior teeth are going to be. So I don't want something like this, and I don't want something like this. That's why we make them thinner in the anterior section like this, because I can warm this up under warm water, and I can easily move that contour of that wax rim. All right, what we want to try to do is have somewhat of a straight line right here. And by basically, once it's warm under the wax, then you can basically take and push with your finger, and then you can see how you can kind of move the wax easily. And I think we like this profile right here. It's pretty straight up and down. It's not too bulky this way, but it's also not receded inward. So basically, if this base plate was not contoured correctly, we would then add alu wax or material to this part of it to open up the vertical. The aesthetic control room was demonstrated in the video the correct profile of the lip. The occlusal plane analyzer will help us in the denture setup. By the use of this particular device, it will help establish the occlusal plane, and it will help prevent a cant or a slant in the setup. Okay, so we have this piece, and then this piece goes into here, and then this is the piece that we're going to tighten up by using this Allen wrench. Level this so it's level with her pupillary line. And what we're looking at right there is right here, her two pupils of her eyes, and this, and trying to level that. Once we get it leveled, we're going to take this Allen wrench and tighten it up. Here you'll see used correctly the occlusal plane analyzer, level with the pupillary line of the patient. Option 2 on registering a vertical is with a base plate bite rim. Understanding how the base plate and bite rims are fabricated may help you when registering the vertical. The maxillary base plate and bite rim, from the vestibule to the length of the wax or to the incisal edge, is set at 22. This number is general for the population. On the mandible or lower base plate and bite rim, that dimension is set at 18. These dimensions can be altered and changed, but in general, when leaving the laboratory, 22 on the upper and 18 on the lower is where the wax will be set at. When selecting the anterior teeth, Dental Crafters offers 3 options: premium, standard, and economy. Premium Vita Physiodent teeth are used in our high-end aesthetic cases. Standard is our basic setup. Economy is usually used in temporary type situations, flippers, and treatment partials. Your selection can be made on the RX form in the denture section. Here you'll see premium, standard, and economy. In selecting the shade, we recommend using one of 2 shade guides, the Vita Vacuum Shade Guide or the Vita 3D Shade Guide. That selection is then also indicated in the shade area on our RX form. One thing that is helpful in an anterior setup is to start to direct your laboratory on how you would like the anterior teeth arranged. We have available some guides that will help you select how you would like the position of those anterior teeth to be. The 3 compositions that we're going to be using are the basic, the soft, and the strong. This then can be indicated on the RX form under the mold section. The patient's face shape or profile of the patient's face is important in helping us select the anterior teeth. By circling one of the 4 indicated face shapes, we then can help select a tooth that will look aesthetic and function correctly in that patient's profile. In a posterior tooth setup, there are 3 options in how we can arrange and select the teeth: flat plane, lingualized, and balanced. To oversimplify occlusal function, we're going to categorize people in 3 areas or types. There's the cow, the rat, or the rat-tow. In the cow, the patient has a lot of lateral movements and grinding functions with their teeth. In a rat, there's a quick up and down motion with little to no lateral movements. In a rat-tow, it's a combination of both. Understanding this occlusal function will help you select whether you would like flat plane, lingualized, or balanced occlusions. It can be indicated on our RX form in this section. Flat plane works well in a cow situation. Balanced works well in a rat situation. In a rat-tow, a lingualized setup may be beneficial. At appointment number 4, we're going to the wax try-in. At this particular stage, we're going to want to check the occlusion, phonetics, aesthetics, and of course getting the final approval of the patient. One other thing that we might want to take a look at is the buccal corridor. The buccal corridor is the space from the teeth from the patient's lips. As indicated here, there should be black triangles that form in those areas. If the arrangement of teeth are too wide, those black triangles will become too small or non-existent, giving the patient a toothy look. We would like to create these buccal corridors in an aesthetic case. At the final setup stage, we're also going to want to check the occlusion. We recommend using some type of occlusal tape to indicate where the contacts are. We also suggest having the patient follow through a number counting starting at 60 to 70. If the setup is incorrect, there may be some phonetical problems pronouncing those particular words. After you have checked occlusion, phonetics, aesthetics, you have the patient's approval, and you want to move forward with having the denture processed, return it to the laboratory. At the delivery appointment, if everything was followed as described in this video, the delivery should be less than a 15-minute process. We hope you found this presentation helpful in fabricating a denture. Any questions, please reach out to us.